Are you tired of struggling with your weight and dreaming of being a skinny legend like the glamorous Kylie Jenner? Meet Elvie, a bubbly and outgoing woman who has always embraced life with joy and happiness. Despite her vibrant personality, Elvie struggled with her weight for years, trying countless diets and exercise routines with little success. Frustrated and disheartened, Elvie was ready to throw in the towel, accepting that her life would be full of fluctuating waistlines and unfulfilled resolutions. That is, until she heard about Semaglutide, also known as Ozempic, a new medication that promised to be a game changer in the world of weight loss and diabetes. But first, how did Semaglutide come about? In the heart of Denmark, nestled among the picturesque landmarks, a team of scientists at Novo Nordisk embarked on a mission to develop a groundbreaking treatment for diabetes. In 2012, they were able to develop Semaglutide, a once-weekly diabetes therapy drug that is a longer-lasting alternative than the current medications on the market. It was given the brand name Ozempic. Little did they know their journey would lead to a discovery about its remarkable weight loss benefit, as the 2022 review of anti-obesity treatments found that it was a promising anti-obesity drug. Now you must be thinking, what is it?
Now, let's look at the structure and synthesis of semaglutide. Semaglutide is a synthetic peptide drug, which has been increasing in popularity after the synthesis of oxytocin. This was by Professor Du Vigneault. And the reason why this is becoming very popular is that drugs created by recombinant DNA techniques is now all the rage due to its ease and simplicity. Next, let's look at the chemical formula. The chemical formula of semaglutide is C187, H291, N45, and O59. The molecular weight of this drug is 4,114 grams per mole, or Daltons. Next, there are 57 hydrogen bonds donated, 63 hydrogen bonds accepted, and 1,650 of angstrom polar surface. Let's think back to Lipinski's rule of 5. Lipinski's rule of 5 states that a drug should have no more than 5 hydrogen bonds donated, 10 hydrogen bonds accepted, no more than 500 grams per mole for the molecular weight, and less than 5 for 5 angstrom polar surface, compared to 8 optimal. This drug does not follow any of these. So, looking at that, it's because drugs produced by recombinant DNA techniques, for example, can produce very long peptide chains. And simply put, it's due to the ease of the new technology. Furthermore, the drug is made of 31 amino acids. It is both a lipopeptide and a polypeptide.
So Ozempic, how does it work? Ozempic works by mimicking the hormone GLP-1. And GLP-1 is a physiological incretin hormone from the lower GI tract that functions to stimulate insulin release from the pancreatic islets. So Ozempic works by mimicking this hormone to raise insulin secretion and lower glucagon secretion from the liver, thus lowering overall blood sugar levels. Since high blood sugar levels lead to storage of glucose as fat and subsequent weight gain, Ozempic can prevent this and ultimately help with weight loss. Through mimicking GLP-1, raising levels of Ozempic has also been shown to cause slower gastric emptying and reduce food intake by signaling to the brain that you're not hungry. The combined effects of slowing digestion and suppressing appetite make Ozempic ideal for weight loss.
Hey, Professor Syed, how does this affect people with type 2 diabetes?
Type 2 diabetes, great question. Diabetes is associated with strong fluctuations in blood sugar levels and the consequences of having either too high or too low blood sugar levels from the norm. So semaglutide can fix this by stimulating insulin production from the pancreas, which regulates blood sugar levels as it lowers blood sugar levels that are too high.
Another possible future use for semaglutide includes anti-inflammatory purposes. Daniel Drucker at the University of Toronto in Canada conducted a study of injecting mice with bacteria from their stomachs into other parts of their abdomens, creating a bacterial blood infection. This increased inflammation by triggering a potent immunological response, which was then reduced by injecting semaglutide. This can open the door for other uses of semaglutide other than weight loss, such as treating certain inflammatory conditions as well. Moving on to side effects of Ozempic. Common side effects include mainly a variety of gastrointestinal issues such as nausea, diarrhea, stomach pain, vomiting, and constipation. These issues can often be mitigated by starting on a lower dose and then gradually increase the amount. Other more serious complications include possible thyroid tumor growth, pancreatitis, hypoglycemia, vision changes, and kidney and gallbladder issues. It's essential to discuss any potential side effects of Ozempic with your healthcare provider before starting the medication. They can provide personalized advice and monitor you for any adverse reactions while you're taking the drug. Make sure to update your primary care physicians if any of these symptoms arise or anything out of the ordinary. Avoid semaglutide if you have a history of medullary thyroid cancer, gallbladder disease, pancreatitis, and multiple endocrine neoplasia syndrome type 2.